The Biden administration is unveiling new plans to fight the spread of the highly contagious Omicron coronavirus variant. In a White House address Tuesday, President Biden said the government would make 500 million rapid at-home tests available to Americans for free starting in January. He also says his administration will increase support for hospitals and add more testing sites in hard-hit regions. Experts say the Omicron variant spreads faster than other coronavirus strains, including Delta. Health officials are urging people to get vaccinated, boosted, and tested before gathering for the holidays. Omicron has already accounted for nearly 3/4 of new infections last week. New York is seeing a major wave. Nancy Chen has more.
Elaine, just days before Christmas, it's a scramble against fast-moving Omicron, with the CDC predicting record-high new infections nationwide as soon as January. Here in New York, more than 1 in 10 tests is coming back positive for COVID. In Times Square, the crossroads of the world, long lines to get tested as the rapidly spreading Omicron variant grips New York City. 92% of cases in the area are connected to Omicron, and the city is testing more than 130,000 people each day, double the number from just 3 weeks ago. Today, Mayor Bill de Blasio announcing a reward for booster shots.
Get your booster shot, get a $100 incentive.
And there's rampant COVID testing in Chicago, where Mayor Lori Lightfoot set proof of vaccine requirements for restaurants, gyms, and entertainment venues.
This is what we have to do to keep our health system from becoming overwhelmed.
And tonight, the CDC reports more than 1,000 children have now died from COVID since the beginning of the pandemic. Research shows that the risk of household transmission is nearly 3 times higher for Omicron than the Delta variant. 1 in 5 hospitals nationwide expects a staffing shortage within a week.
Each variant has its own little shop of horrors. And in the case of the Omicron variant, that's what this is, that 1-2 punch of so many people getting infected and knocking out a substantial segment of our healthcare workforce at the same time.
Peter Hotez is a virologist at Houston's Baylor College of Medicine and recommends a 4th shot for healthcare workers and those who are immunocompromised.
The level of protective immunity after the 3rd immunization against the Omicron variant wanes, declines pretty rapidly.
Massachusetts is one of several states activating the National Guard to support hospitals as Omicron spreads.
You think that people should reconsider holiday plans?
I think people should take a hard look at them and really think about their individual situations with their families.
In another weapon, in the fight against COVID, the FDA is reportedly expected to approve treatment pills for COVID by Merck and Pfizer sometime this week. The pills could be taken at the early onset of symptoms and help prevent hospitalizations, Elaine.
Nancy Chen, thank you. For more, let's bring in Dr. Ben Weston. He is an associate professor in the Department of Emergency Medicine at the Medical College of Wisconsin and the director of medical services for the Milwaukee County Office of Emergency Management. Dr. Weston, welcome. We are seeing long testing lines in many parts of the country. The Biden administration is going to send out free at-home tests to people who ask for them starting next month. How do these home tests compare to lab tests?
Yeah, thank you for having me back. Well, it's important to remember that the home tests are more limited than the lab tests. They're not quite as sensitive. They don't pick up the disease for quite as long. But what's important is they're very convenient. You can do them right at home. It takes about 15 minutes, a quick swab, and you get a result right then. So it is a critical step to fighting the pandemic.
And President Biden, we know, is deploying troops to help staff medical facilities caring for COVID-19 patients. How is Omicron impacting hospitals right now? And are you concerned this variant may strain hospitals even further?
Oh, absolutely. Many hospitals, I'll speak for my own state of Wisconsin, our hospitals are frankly underwater. And that's before we even really began the anticipated flood of cases from Omicron. So there's entire regions of states, my own included, that have 0 ICU beds available. And that's an incredibly high-risk situation considering our likely COVID trajectory in the coming weeks.
Well, Dr. Anthony Fauci says the CDC is considering reducing the recommended COVID isolation period for those who are fully vaccinated. Doctor, remind us, how many days typically is COVID-19 contagious?
Well, we typically tell people to isolate after finding out that they're positive, after their symptoms begin, for about 10 days. Now, what he's been talking about are healthcare workers specifically. We talked about before, hospitals are out of beds. Part of that is a space issue. A lot of that, though, is a staffing issue. And so if you look into this issue, a healthcare worker who's vaccinated, who's boosted, who gets a breakthrough infection, how high is their viral load, especially if they're asymptomatic, and can they safely come back a little bit earlier to help patients in need, especially if they're wearing a high-quality medical-grade mask? Can they keep themselves, and most importantly, can they keep their patients safe?
Well, according to AAA, more than 109 million Americans are expected to travel between December 23rd and January 2nd. The TSA is also seeing pre-pandemic levels of travelers at airports. Can we expect this COVID-19 surge to get worse before it gets better? And what advice do you have for people who are still going ahead with their holiday travel plans?
I think certainly things are going to get worse before they get better. Testing is critical for travel. Test before you travel. We saw, again, with Biden's plan to send at-home tests. I think it gets to the point of equity. There's a lot of people out there who, for a $10 test at home, it's a very difficult time for millions of Americans to access these tests, particularly vulnerable populations that get hit hardest by COVID. But I think if you're traveling, you have to be cautious. If you're vaccinated, if you're boosted, if you're wearing a high quality mask, not a simple cloth mask, but a procedure mask or ideally a KN95, then I think you can feel a lot more comfortable traveling. But if that's not the case, you really should consider the risk of that trip and whether it's worth it.
And so bottom line here, doctor, what do you say to people that really feel compelled to gather with their loved ones, right? As we've heard, this is the second sort of COVID Christmas that Americans are going to be living through. If they can't get their hands on a test or they can't find a place that will see them quickly enough to get that rapid test, what should they be doing, you think, before they actually sit down, enter a relative's home and actually gather with loved ones?
I think it's all about layers of protection. The most important layer is the vaccine and the booster. If you have your vaccine and you have your booster, you're way ahead of the game. Now, on top of that, the next layer is masking. Another layer is testing. Ideally, you can combine as many of those layers as possible. But when you start chipping away at those, you take one away, you take two away, then you have a less safe event. And then you have to consider who's there, what's the risk, and really, is it worth it?
And opening windows and these kinds of things, doctor, do you recommend that? Because inevitably there may be households where one might not know the status if someone is actually vaccinated or not.
Yeah, ventilation is critical. I'll tell you, here in Wisconsin, it's pretty cold outside. Yeah. Cracking the window is a little more difficult, but certainly if you live in warmer climates, or even if you can just open the window a little bit, get that cross breeze, that ventilation is critical for really bringing down the rates of transmission. So it's all about masking, distance, ventilation, and then vaccine.
All right, Dr. Ben Weston. Doctor, thank you very much.
Thank you.